Okay, here's my ID. I'm gonna scan my room. So the first thing I would do is verify orders and hospital policy, and then verify patient identity using the patient's armband. I have Jaguar Jones, date of birth 8/25/63, 8/25/63, medical record number 417-417, 6352, 6352, and then I would also compare allergies on the patient's chart to the patient's armband. I have allergies penicillin. I would then explain the procedure to the patient, pull the curtain to provide privacy, and then I would gather my equipment. I have my enema bag, my Castle soap, which I'm also going to pretend is my water-soluble lubricant. I have my clean gloves. I have my bedpan. I have my goggles. I would have waterproof linens. I'm going to pretend this is my waterproof pad. I would have towels and wash rags and an IV pole. So the next thing is I'm going to perform hand hygiene and then put on my goggles. Now I'm going to clamp my tubing and then fill the enema bag with 750 to 1,000 milliliters of warm water or saline, whichever one is ordered. And then also, if ordered, I would put in the Castle soap and then gently agitate the bag. Now I'm going to prime the tubing and then reclamp. Sorry, I'm getting water everywhere. And then I would reclamp, and then I would place the enema bag. I would place the enema bag on a firm surface, but not the bed, or either I would hang it on the IV pole. Now I'm going to don my gloves. And then I would position the patient. I would raise the bed to a working height, lower the side rail, and I would assist the patient to the left lateral Sims position. And I would put the waterproof pad under the patient's buttocks. The next thing that I'm going to do is lubricate the tubing. And then I would gently but firmly place my hand on the patient's hip and instruct the patient to take slow, deep breaths throughout the procedure. And with my non-dominant hand, I will retract the buttocks and insert the lubricated tubing 3 to 4 inches in the rectum. If the patient has hemorrhoids, I would instruct the patient to bear down, and that would facilitate the insertion process. And then I would remove the enema bag from the IV pole, and I would unclamp and hold the bag 12 to 18 inches with the bedpan nearby at all times. If the patient experiences cramping or discomfort, I would either lower the bag or I would reclamp and instruct the patient to take slow, deep breaths. After the enema bag is empty, I would reclamp and then remove the tubing and discard. I would instruct the patient to hold the enema for 10 to 15 minutes, and then I would assist the patient to the bedpan, the bedside commode, or the restroom. And this is the bedpan. This is the area that would go underneath the buttocks, and then this area would go below the patient's thighs. After the patient uses the restroom, I would perform perinatal care, and then I would assist the patient back in the bed. I would lower the bed to the lowest position, raise the side rail, and then I would document that the enema was completed. I would document the amount of enema, the type of enema given, the time it was given, the amount of return, also the color, how the patient tolerated the procedure, and also how the patient was left after the procedure.